Hey there, it's Dr. Todd Cameron here, GP and founder at M3 Health. This is a brief video just to talk to you about COVID vaccinations and what we are doing with our communities to try and make an impact. The first thing is you might still be thinking, why vaccinate against COVID? There are a couple of things I want you to keep in mind here. Delta has changed the game dramatically. It is much more contagious than the original version of COVID, and it realistically means that as a community, we cannot achieve something called herd immunity. Herd immunity effectively means that some people can avoid vaccination on the basis that enough other people get vaccinated, and therefore they will be protected and safe, much like what happens with, say, measles or whooping cough. The reality is that is not possible with COVID vaccination. So I'm going to say to you right here, right now, that if you choose not to receive a COVID vaccine, the odds are extremely high that in coming months and years, you will be exposed to COVID, and then you'll be trying your chances because none of us knows how our body will respond to that infection from coronavirus. Now, I'm going to ask you to think about what you believe is the most common thing that patients ask as they enter the intensive care and they're about to be intubated. Yep, you've got it. The most common question is, can I receive my vaccine now? The answer to that, unfortunately, is no, it's too late. So the best vaccine you can get is the one that is in your arm now. Remember, with all vaccines available, we need to have 2 doses. And so what I'm going to do now is invite you to actually use the right information, because our receptionists are being completely swamped and our ability to offer normal care in our clinics is being compromised by the amount of questions we're having about people trying to change the vaccine that they are able to receive. The first thing is there are 2 vaccine types at the moment that can be received in general practice, both of which have an almost 100% rate of preventing you dying from COVID. That's really, really important. Your rate of hospitalizations are vastly reduced. The odds you end up in intensive care requiring ventilation are almost zero. So both do pretty well the same work. There is no difference in that. 60 and above is all AZ. 59 and below is Pfizer. Do not try and convince our team otherwise. You need to go for the vaccine that the government has determined. We have been charged with the responsibility of delivering the government vaccines as described by them. So you must use the eligibility checker. Our decision is that we wish to impact more than 2,500 patients per week with vaccines across our 3 clinics. That is our ambition. In order to get there, we need you to help us. But we know the only way out of this pandemic, preventing future lockdowns, is to get as many people vaccinated as possible so that we do not overwhelm our health system and have unnecessary death and suffering. That is our mission. So what I need you to do, 3 things. Please do not call our reception team. The first thing to do is to determine your eligibility using the government eligibility checker. Answer that honestly, because if you come in and you haven't answered it honestly, we're going to have to send you away until you are eligible. The next thing, so the first thing is use the eligibility checker to determine what you can receive. The second thing is book online. You will receive all of the information and consents via the communications that come from our clinic, and you must bring ID. So those 3 things: use the eligibility checker, book online, bring your ID, get the vaccine that you are eligible to receive now, get it in your arm. We'll see you